Hello, I'm Dr. Gracke.
Hi.
What's your name?
I'm Dinah.
Dinah. Nice to meet you, Dinah.
Sure.
Can I call you Dinah?
Yes, absolutely.
Perfect. Okay, so Dinah, what is your date of birth?
I'm 25.
Okay. Sounds good. Okay. So what brings you in today, Dinah?
I have a low back pain.
Low back pain. Okay. Can you point to the low back pain?
Yeah, it's real low.
Okay.
Right here.
Okay. And does this pain travel anywhere? Through your legs, up your back?
It's very sharp.
Okay.
Yeah, it's just way down at the bottom. Right here.
Okay.
Yeah, that's all I got for
Okay.
you.
So you describe it as a sharp
Yeah,
pain
it's very sharp.
and does not radiate.
Nope, it does not radiate.
Okay. So on a scale of 0 through 10, could you rate this pain? 0 being no pain, 10 being the worst.
Right now it's a 6.
Okay. Currently a 6, and at best.
A 6 is the best
Okay.
it's been.
And at worst.
An 8.
Okay. So when has this pain brought upon? How long ago?
It was about 5 days ago.
5 days. Okay. And since 5 days ago, has it gotten better? Has it stayed pretty constant or gotten worse?
It's slowly getting better.
Okay. Do you remember or recall anything that you were doing to onset this pain?
I bent over, and when I tried to stand up, it hurt.
Okay.
What about its best?
All right. Is there any time during the day that this pain is better or worse?
Does it radiate anywhere? Or does it stay right in that area?
No.
Okay. It's just pretty constant then? Okay.
Is there a setting?
Is there a specific setting that causes these symptoms or the pain to be worse or better?
No, nothing that I noticed.
No environment or stressors?
No, nothing that I
How
noticed.
about timing when it comes in?
Okay. So has this pain affected your activities from day to day?
Things that make me bend over hurt. Like
Okay.
sitting in class is very uncomfortable.
Okay. You say this pain has been slowly getting better. What kind of things have you tried yourself? Or anything that alleviates the pain?
Well, like laying down alleviates.
Okay.
And like I've already said, the sitting for a long time makes the symptoms worse.
Okay.
Makes it worse, definitely.
Okay. Okay. And then, are there any other associated symptoms that you've experienced with this pain?
No, it's the
Okay.
first time I've experienced this pain.
Okay. And this is the first time you experienced it.
Yeah.
Am I the first healthcare provider you've seen?
Yeah, I
for
haven't
this
seen
pain?
anyone else.
Okay. Okay. Okay.
And you did, I know you did ask me at any time of the day is it worse. It midday seems to be the worst.
Okay.
Worst time.
Midday
Yeah.
seems to
Yeah.
be the worst. Okay. All right then. That might be it. Have you experienced any unexplained fatigue recently?
No.
Okay. Have you experienced any weight change recently?
No weight change.
Have you experienced any change in thirst?
No.
Okay. Appetite?
No.
Okay. How about any fevers, chills, or excessive sweating?
No.
Okay. Any pain that doesn't change with position?
No.
Okay. How about any pain that wakes you up at night?
No.
Okay. And then any any excessive bruising or easily bleeding?
No.
Okay. 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 So, have you had any surgeries in the past?
No.
Okay.
Oh, actually, I have had my wisdom teeth removed.
Wisdom. Okay. And how long ago?
I was 17.
Okay.
17. Any
And everything. Any complications
No,
with it?
no,
Okay.
it was good.
Okay. Any traumatic events happen to you or accidents?
No, no,
Any sprains, fractures,
nope, nothing,
stitches?
nothing like that.
Okay. How about any serious illnesses or hospitalizations?
No, none.
Okay. Good. Are you currently taking any medications or supplements?
I take Centrum every day.
Centrum? Okay, every day.
Yep.
And do you know what that's for?
Nope, not sure. My doctor said just to take it.
Okay, and the dosage?
Just one pill
Okay.
every day.
1 pill per day. Okay, and that seems to be working then?
Yeah, it's good.
Good. So, how many hours of uninterrupted sleep do you get per day?
About 8.
Per night. Okay, about 8. And this seems to be good then? No problems with that?
Yeah, I feel well rested.
Okay, good. And have you ever been tested for sleep apnea?
No, I've not.
Okay.
do you take caffeine?
Okay. And then, typical diet for breakfast, lunch, and dinner.
What's a typical breakfast, lunch, and dinner?
So I eat toast for breakfast.
Okay.
I have salad for lunch, and then some chicken and vegetables for dinner.
Okay.
Like I'll have some euros for snacks.
Okay. So pretty well balanced. It's good. Do you consume any caffeine?
No.
Okay. Do you take any tobacco products? Use any tobacco products?
No, I don't.
Okay. Do you consume any alcohol?
Do you use tobacco? Does anybody around you smoke or use tobacco?
I have one big margarita every Friday.
One beer. Okay.
How often do you use it? How many drinks do you have?
So once a week then. Okay. And then any use of recreational drugs or prescription medications that weren't used for you?
No.
Okay.
Just a big thing. Is the stress.
Okay. Do you exercise?
No.
Okay. No exercise.
Have you ever used?
Exercise. Okay. And then, do you currently work?
Yeah, I'm a student now, but I've worked at Taco John's.
Okay. And have you always felt safe in those conditions, working environment?
What's
Yeah.
What are your hobbies?
None. I study all the time.
Studying all the time, busy student.
Yeah.
Do you when you ride in a car, do you wear your seatbelt?
I use my seatbelt. I use my seatbelt when I drive. Yeah.
Okay. Do you wear a helmet if you ride bicycle?
Yep.
And sunscreen when you're outside?
Yeah.
Okay. Safety, there you go.
What jobs?
Safety jobs. Okay. Do you consider your support system your family? Do you have a support
Yeah.
system? Okay.
Yes, I do. Yep.
Good. And then do you have a good home life?
Yep.
Okay.
Yep.
Any past history of domestic violence or abuse? Okay.
Do you feel like you have a safe home life? You have a good support system?
All right.
Yeah.
So now I'm gonna ask some questions about your family history. Do you know who your biological family is?
Yes.
Okay. Are there any? Do your parents have any health conditions that I should be aware of?
None that I know
Okay.
Do you know your biological families?
Okay. And then, do you have any siblings?
Your parents have any health conditions?
of. Yes.
Okay. How many?
How about your grandparents?
Does it, have any siblings?
Or do they
If
have?
you have any siblings, what health conditions do your siblings have? It just says yes and then and none.
Okay.
How about
Okay.
do you have any brothers or sisters?
Okay. And then, do you have any children?
No.
Do you have any children?
Are your grandparents still with us? Do they have any health conditions, or have had any?
All right.
I think my grandmother had diabetes,
Okay.
and my grandfather had a heart attack.
Okay. And
Any moles that you've seen
how about?
in the past 12 months?
Is that your mom's side or dad's side?
Checked.
Do you know?
That
Any
is
changes in color in your hair, skin, nails?
my grandmother had had diabetes, and my father had a heart attack. I don't know about the
Which
diabetes.
side? Okay.
A heart attack happened in its 80s.
Okay. In the 80s.
Anything like that? Your ears, have you had ringing in your ears? Lost it?
So now I'm going to ask a series of questions. It might get repetitive, but all you have to do is answer yes or no, and we'll bear through it and get through it.
Okay.
Do you have any issues with, or had any problems with your hair, skin, or nails?
No.
Any change in skin or nail color?
No.
Any increase or decrease in hair growth?
No.
Any new moles?
No.
Okay. Any
Your nose,
any rashes or
No.
itching?
No.
How about when was the last time a doctor has checked for signs of cancer with your moles? Do you know?
sinus.
Never.
Okay. Okay. Have you had any head trauma?
You ever have sore throat?
Nope.
Okay. Any dizziness,
No.
vertigo,
No.
lightheadedness?
No.
Have you had any
Cavities, braces,
any ring in your ears?
no jogging,
No.
like that.
Have you experienced any discharge from your ears,
No.
or experienced any hearing loss?
No.
Okay. And then, have you you wear glasses or no?
Any sores or any
Or contacts?
No. No.
Okay. Do you know when your last eye exam was?
No.
Okay. Have you had any blurry vision,
No.
spotted vision,
No.
bright flashes,
No.
double vision?
No.
Okay. Have you had any discharge from your nose,
No.
bloody noses?
No.
Okay. Any deviated septum where your nose goes to the side?
No.
Okay. Are you allergic to anything?
No.
Okay.
anything with exertion?
Have you had difficulty swallowing?
No.
Any hoarseness
How about
in your throat?
No.
Okay. Any impaired speech?
No.
Any sores around your mouth or inside your mouth?
No.
Have you had braces?
No, I've never had braces.
Okay. How about cavities?
no? A little bit on your lungs here.
No.
Okay.
History of asthma, pneumonia.
Sounds good.
Have you ever coughed?
Okay. Have you had any shortness of breath?
No.
Experienced any palpitations in your chest or racing of your heart?
No.
Okay. Any shortness of breath with exertion or pain in
No.
your chest?
No.
Okay. Ever experienced your hands or feet go cold
No.
or discolorations in your hands or feet?
No.
Okay. Have you had any severe respiratory infections or colds
No.
or any cough up anything in the sputum?
No, no,
Okay.
pretty good with that.
Okay. Okay. So have you had any upper abdominal pain,
No,
lower abdominal pain?
no,
Have you experienced any bloody vomit?
no,
Any
Any troubles in urination?
heartburn,
no,
nausea?
no.
Okay. Good there. How often do you have a bowel movement?
I have a bowel movement about once a day.
Once a day, and then
And, like I would describe them as like long and skinny.
long, skinny.
And
Okay.
they're, like brown looking.
Okay. Long, skinny, and brown. Okay. Regular. Good. Okay. Okay. How many times do you urinate a day?
I urinate about 4 times a day.
4 times. Okay. Have you experienced any change in urine output?
No,
Any change in color,
no,
smell?
no,
Okay. Good. Any history of UTIs, urinary tract infections?
no.
Okay. So good there. And then we'll go into some more personal questions if that's okay. Have you experienced any, are you sexually active?
Yes.
Okay. Do you use any forms of birth control or contraceptives?
No.
Okay. And then, do you perform self-rex exams?
Yes.
Have you experienced any lumps or bumps in your breast?
No.
Okay. When was your last pap smear?
Last year.
Okay. And anything, did the doctor say anything about
No,
that?
it came up normal.
Normal, okay. Alright, normal. Okay. And then have you had any vaginal discharge or discharge from your breast?
No.
Okay. And then you said you had no children. Are your periods regular?
Yes.
Okay. About how long is your cycle?
About 28 days.
Okay. Any irregular bleeding or?
No, no.
Okay.
About 28-day cycle, and,
Yep.
and my period lasts about 5 days.
5 days.
Yep.
Okay. Good. Have you had any soreness in your muscles or
No.
weakness in your muscles?
No.
Any joint pain? History of arthritis?
No.
Pain in your calves while you're walking?
No.
Stiffness in any joints?
No.
Okay. Right there. Any frequent fractures?
No.
Okay. Sprains? Okay. Any history with diabetes or thyroid issues?
No.
Any enlarged glands?
No.
Okay. Any frequent infections?
No.
Okay. Any intolerance to cold or the warmth?
No.
Okay. Okay. Have you had any past history of losing consciousness?
No.
Shaking tremors?
No.
Any tingling in your arms or legs or numbness?
No.
Okay. Any history of depression,
No.
anxiety,
No.
staying asleep or falling asleep?
No.
Okay. Okay, I think that is all I have for you. Let's get you checked out and we'll get to the bottom of this.
All right. Thanks, Doc.
Yes.